Hello, everyone, and welcome to our Narcan training presentation today. My name is Mary, and I am the Alumni Coordinator over here at Red Rock Recovery Center. Today, we're going to be talking about how to properly identify the signs of an overdose, the emergency procedure when administering Narcan, and how to administer Narcan. We are going to get started here. All right, so first question is, what is Narcan? Narcan is the fancy word for the generic name of naloxone. It is a life-saving medication that reverses the effects of an opioid overdose. It does only reverse the effects of an opioid overdose. However, it does not have any adverse effects or reactions. If somebody is not experiencing an opioid overdose, administering Narcan will not cause any more harm, put anybody in danger, or cause any harmful effects. Narcan, we are going to be talking about the nasal spray today. It is used by first responders. It is made available to family, to friends, requiring no medical background to be used properly. Something very important to note, in any case when Narcan is administered, 911 is always to be called. Even if Narcan is successfully administered and the person does regain consciousness, 911 is always to be called. Here are some ways of how to properly identify the signs of an overdose. The first is being unresponsive to verbal or physical stimuli. So, to call their name, are you there? Are you okay? Can you hear me? Shaking them firmly. You don't want to be too shy about this, too gentle. You want to give them a firm shake, see if they wake up or respond to that. Last but not least is something called a sternum rub. This is to cause a painful stimuli. You're going to make a fist, something like this. Have the bony parts of your knuckles sticking out and rub them on the sternum right here in the middle of the chest. Rub up and down very firmly. The next is slow or labored breathing. In the medical field, this is something called the death gargle. It is typically when the respiratory system has been depressed to a point where saliva is no longer being swallowed properly, the lungs are no longer expanding, and the person is not getting enough oxygen to their system, to their cells, or to their brain. A weak or absent pulse. You can find somebody's pulse by taking two fingers and putting it right about here, right where the jaw bone and the neck meet. Can feel for a weak or absent pulse. Another way is the inside of the wrist, right about here, beneath the thumb, where the thumb meets the forearm. If you cannot feel a pulse, whether somebody is overdosing or not, 911 is always to be called, as that is definitely a sign of emergency. Bluing of the lips or the nail beds. As you can see in the picture on the right, the hand on the right is one that is cyanotic. So that means that you can see the bluing of those fingers, those fingertips, the nail beds, and kind of this waxiness of the skin. The hand on the left is healthy. While this is an extreme case of cyanosis, typically it is most commonly seen right in the nail beds and the lips. That bluing basically means that the cells are not getting enough oxygen. It is actually a sign of cell death, and the extremities will begin to turn blue. One more way to properly identify signs of an overdose is that if somebody is unconscious and there is drug paraphernalia in the room or around them, it is common that they are unconscious due to a drug overdose. Things like spoons, like drugs, like dirty needles, stuff of that sort can all be a good sign of a drug overdose. The emergency overdose procedure is pretty much as followed. So you assess the situation, what we talked about, are they conscious or responsive? Call their name out loud, give them a firm shake, and apply the sternum rub. If they remain unresponsive, they do not regain consciousness, call 911 immediately. The next step is to take Narcan out of the packaging. It does come in a box with 2 Narcan doses that are 4 milligrams each. The Narcan box will look like this. Take the Narcan out of the packaging. It will look like this. You'll insert the nose piece as far into the nostril as possible. You cannot cause any harm with that. Put your fingers like this. The plunger is right here, and once inserted deep into the nostril, you will squeeze the plunger, thus releasing that dose of Narcan. You do not want to squeeze the plunger until the nose piece is inserted inside of the nostril, or else that dose of Narcan will be wasted. Administer rescue breathing or CPR. As you can see on the diagram of the right, that is the position of rescue breathing. You want to lift the chin up and the forehead back to allow proper open airway. You will give 2 deep rescue breaths. If you know CPR, you will also follow the following procedure to administer CPR. Watch for signs of consciousness, breathing, blinking, movement. If somebody is still unresponsive after 1 to 2 minutes of the first administration of Narcan, you can apply the second dose to the opposite nostril, and then continue rescue breathing or CPR until paramedics arrive. There are a few different risks that come with the administration of Narcan. Here are just a few to keep in mind. Dirty needles in surrounding area. Typically, when an overdose does occur, the person does not have time to put caps on their needles, put their drugs away, stuff of that sort. So there is commonly paraphernalia in the surrounding area, which does include dirty needles. Bloodborne pathogens are commonly carried through dirty syringes. Therefore, be aware of your surroundings and make sure to not get stuck. This can be avoided by not putting hands in the pockets of somebody and just watching your surrounding area. Confusion, agitation, or aggression upon regaining consciousness. It is very common for the person who has been administered Narcan, when they do regain consciousness, to be very confused, to be upset, just not be a happy camper, and to come at it from a soothing, a gentle place, and know that they may not be the happiest with you in that very moment. So trying to keep as calm as possible, because they will more than likely not wake up very happy. Vomiting and aspiration is a high risk when dealing with an overdose. As you can see in the diagram on the right, that is a picture of the recovery position. This is to keep the airway clear in case of vomiting. You lie somebody on their side. You put their bottom arm under their head to support it and their hand under their jaw to keep the mouth open. You then put their top leg in front of them to keep them from rolling onto their stomach. Aspiration is when somebody vomits and it then goes down into their lungs or their airways and can cause asphyxiation or suffocation. Precipitated withdrawals. So for somebody who is physically dependent on opiates, when Narcan is administered, that naloxone knocks the opiates off of the receptors in the brain very suddenly. So typically when somebody who is physically dependent on opiates, it has Narcan administered to them, they wake up in what's called precipitated withdrawals. Since those receptors are now empty, they do not have opiates in them, they are feeling the physical effects of opiate withdrawals. The last but not least is something called re-overdose. The half-life of Narcan is 2 hours, which means after 2 hours, the effects of the Narcan start to wear off. Typically, the half-life of most opiates on the streets or medications is about 4 hours, which means that the effects of the Narcan wear off before the effects of the opiate does. Therefore, even if somebody regains consciousness after administering Narcan, it is always very important to call 911. They will take that person, watch them, make sure that they are taken care of, and just observe them over the course of the 4 hours to make sure that they do not re-overdose when the Narcan wears off out of their system. Something very important to note when talking about overdose is the Good Samaritan Law. This protects civilians who aid an injured, ill, or distressed person in an emergency situation. Often, very often with overdose, The care given to the person who overdosed, either by rescue breathing, administering Narcan, or a combination of those, can be the difference between life and death before the ambulance arrives. Those first few immediate minutes are so vital to somebody living through a drug overdose. The Good Samaritan Law protects those who offer assistance in the case of overdose from legal actions such as medical negligence. So in the case that there are cracked ribs from CPR, broken sternum or bruised sternum, anything of that sort, that person who has administered that medical attention is protected under the Good Samaritan Law. Something also very important to note about the Good Samaritan Law is that it does offer immunity to those who are giving medical attention and call 911 who are in possession of paraphernalia or a controlled substance. So if a friend or a person who is with that person who overdoses calls 911, administers Narcan, and is administering CPR or observing them until 911 gets there, they will be offered immunity in the state of Colorado from any legal action being taken against them under the Good Samaritan Law. So today we are just going to talk about Narcan nasal spray. However, it is important to note that there are 3 different forms of Narcan shown below. All the way on the right is the intramuscular injection. It does come with a syringe and a vial of Narcan, and being intramuscular, it is administered directly into a muscle. The atomizer is what takes the Narcan that is in the syringe, it adds an atomizer, and it turns it into a nasal spray. The most common, and what we're talking about today, is the Narcan nasal spray that you see all the way on the left. That is the proper way to hold it, what it looks like out of its packaging, and what we typically see as it makes it most user-friendly for those who do not have medical backgrounds. Last but not least, where to get Narcan. In the state of Colorado, you do not need a prescription to get Narcan from participating pharmacies like King Soopers, and it only costs about $5, maybe $5 or $10. You can walk into a pharmacy, ask if you can get Narcan, and they will give it to you, no questions asked. There is also a very amazing resource in Denver called the Denver's Harm Reduction Action Center. They're located downtown, and they educate and provide the public with free Narcan, as well as work as a clean needle exchange. They advocate to protect and help addicts across the state, and they are a wonderful resource for anybody who wants to learn more on how to support and protect and advocate for their loved ones. That is all we have today. That is our Narcan training presentation. If you have any questions or any concerns, my email is above. Feel free to reach out to me at any time, and have a good rest of your day.